Okay, today we're going to start our final exam prep of fundamentals in nursing. So we're going to start not at the beginning, we're going to start on module 8. We'll go 10 and 11, take notes on all those, go through like everything, and then we'll go back to 1 only because we have a test coming up on these last couple ones. So we're going to start on this one first. So let's jump over to this PowerPoint. It's going to be perfusion. We'll go over this. And then next we'll go over the book portion of the stuff that's in there. I'll tell you if I think anything's important in there, we'll go over that. So perfusion, these are things you can read. I didn't find anything relatively important in these pages of the fundamentals book because I thought it was a waste of time, but it's okay. So with perfusion, it's a focused assessment. Occultation for perfusion is big. Mentioned it multiple times. How are you going to assess for perfusion? You're going to do osculation. Listen, you're going to mainly find murmurs, auscultation. Another thing you can do is an echo, but auscultation will help you find those murmurs. You can do EKG or telemetry, medications, and blood through the heart. I will discuss this, but there's a better thing that we have in here that we'll go to later. So, with cardiac monitoring, the basic rhythm recognition that helps diagnose MIs, EKGs. And you also have med therapies, different ones. We'll go over these later. Got these and those aren't that important. We know perfusion. Basic definition is movement of volume. It's like movement central to the heart and volume. You have to keep it simple. Transport system, blood pressure, systole. That's contraction, and diastole is relaxation. Then you have MAP. That's your MAP. It gives us an indication of arterial perfusion. It needs to be greater than 60. To calculate that, you're going to take the diastolic pressure from vessel relaxation, multiply that times 2, and then add that to our systolic pressure, and then divide whatever you get, that total number, over 3, and that's your MAP. Okay? So perfusion, a better definition, is blood flow to cells delivering oxygen or moving waste products. This is a physiological process. And inadequate cardiac output is heart rate times stroke volume for blood transport throughout body tissue. So, what do you think would happen if we don't remove waste from the body? Well, it's going to build up. Then we'll go have hypoxia. We'll go anaerobic, have some inflammation, acidosis, sepsis, and then eventually death. All right, what do you think the route of impulses through the heart is? So it's going to start with the SA node, and that's going to kick it off to the AV. Then that'll hit the bundle of His, and that'll hit the bundle, then that'll hit the Purkinje fibers. Okay, so what is central perfusion dealing with? It's talking about our cardiac output. And what do you think our local or tissue perfusion is dealing with? It's like our vasculature, like O2, fluids, and nutrients. So, there are some risk factors associated with impairment of perfusions. Could you give me some examples? Be things like atherosclerosis, ischemia, calcium deposits, and blockage. So, what do you think cardiac output means? It's the blood ejected from the left ventricle each minute. Then we also have stroke volume. That's the volume of blood ejected during systole. And do you remember what systole is? It is that contraction, remember? So we know heart rate, that's obviously number of beats per minute. So what do you think the formula for cardiac output is? Stroke volume times heart rate. So with our MAP, we know it has to be greater than 60, and normal is 70 to 100, but we go in the hospital basically greater than 60. So if we have a MAP less than 60, what do you think that first sign we'll notice when it goes down? Mentation, good job. So shock, what do you think shock is? Like, what would you say it would be? So we're not getting enough blood flow to the body, so the heart's not pumping enough blood, which basically in turn means the body and cells and the organs aren't getting enough oxygen and nutrients to be able to do their jobs properly. So organs become damaged as a result, and 20% of people get shock kind of die. So some of the symptoms you see of shock, or what do you think they'd be? Like, what would you say there would be? Well, their mentation wouldn't be great. They wouldn't be able to think properly. They probably have some blue color of the skin. Why? Because we're not getting enough oxygen. We know that, like hypoxia. I think they'd be kind of irritable and restless. I think they would if they're not able to get enough oxygen. I'd be kind of irritable. I would be thirsty. I'm not sure why I'd be thirsty though. But then your pulse would be kind of rapid and very weak. You'd be breathing fast because you're trying to get more oxygen, and you'd probably be throwing up and be a little bit noxious too. So looking at this is crazy. It's very interesting. So What do you think the biggest lab for diagnosing heart failure is? BNP. What should that value be? Should be less than 100. Good. So, tell me about sepsis. What is sepsis? So, sepsis is when a bacteria gets in the blood and it causes it to cause immunologic reactions. Basically, it travels throughout the body, causes the vessels to vasodilate, which in turn gets the fluid to leak from blood into surrounding tissues. That impairs the body's ability to pump blood, decreasing blood flow, which eventually leads to shock and eventually leads to multi-system organ failure. So just real quick, what do you think some of the symptoms of sepsis are? So there's an acronym, it's called sepsis. S stands for shivering, gotta have fever or feeling very cold. E is like extreme pain or general discomfort. P is pale or discolored skin. S, it'd be sleepiness, difficulty waking the person up, or confusion. I feel like I might die. And the last S is shortness of breath. So we know, again, just wrapping it up, sepsis, it's infected blood that travels throughout the body, and that infection causes tissues to die over time if you don't take care of it. So what do you think some things that could cause sepsis are? It's pretty crazy. Could be caused by like UTIs and pressure ulcers. Some way to prevent this are, how do you think? Like turning every 2 hours, stuff like that. So what would you say anaerobic metabolism is? It's your body's attempt at getting energy in the absence of oxygen, so like lactic acid, stuff like that. So when your lungs can't keep up enough oxygen in the bloodstream to keep up with the demands of your muscles for energy, waste builds up. It's like the lactic acid. So your blood, maybe your lungs are producing 100 liters of oxygen. That's crazy, but you need 150 liters. Then you're gonna start producing that lactic acid to build up. It's kind of a good example. And then that can eventually lead to rhabdomyolysis, which, what do you think that is? A breakdown of damaged skeletal muscle, and when that breaks down, myoglobin gets released. And myoglobin, what do you think that is? It's basically tissues and muscle, stuff like that. So we got different types of perfusion: pulmonary perfusion, cerebral perfusion. You got 3 to 8 minutes, and then kidneys, stuff like that. So preload, we know preload. What would you say preload is? Is that the pressure or volume? Preload is volume. It's in diastolic volume. Okay, so with heart failure, heart can't fill with enough blood, or the heart can't pump to the rest of the body with enough force. With heart failure, preload is already elevated due to ventricular dilation, increased blood volume. So how do you think you deal with an increased preload? What would you give to deal with that? Well, you'd give diuretics. Then afterload, we know that's pressure. What would we give for increased afterload? Vasodilators. So, looking over this, preload, we know it's the volume. Afterload, that's pressure. Preload is the heart stretching. Afterload is the heart squeezing. Okay? Not too hard at all. So these are some of the things that can cause it. A lot of things can cause it. It's crazy. So when assessing people, when it comes to like perfusion stuff, with central perfusion, what do you think you're mainly going to focus on when you're assessing them? Their heart rate, blood pressure, their labs, specifically BNP, and their lipid levels, and their urine output. What do you think you're going to assess when it comes to cerebral perfusion? The orientation, bilateral movements, sensation, speech, carotid pulses. What about peripheral tissues for that? What are you going to assess for that? Skin's warm, is it proper color, is it dry, are the pulses present, do they have regular rhythm, cap refill less than 2? Hopefully it should be. So, chest pain, what is that dealing with? So we know blood flow, it's not getting where it needs to go. Heart failure could cause it to be back up. Edema can cause pain, stuff like that. We know that. So with our nursing assessments, you're going to notice change in vital signs, specifically blood pressure. You're going to auscultate, see either S3 or S4 because those are abnormal. Are they confused? Do they have any shortness of breath, edema? Are they diaphoretic? Are they sweating? Are they anxious? And do they have any heart rhythm changes, stuff like that? Too bad. So we got some lab diagnostic tests. We are going to skip over these, but I just want to say troponin, that's present in an MI. Predicts the likelihood. Homocysteine, what does that predict? CAD, we know that. come back to these. This will be in the book. Come back to those. EKG, 6-second intervals, multiply times 10. So, okay, PQRST. Here's what we need to know. With the P is atrial contraction, atrial systole. You know that. The QRS is atrial diastole and ventral systole. And the T is the ventral diastole, okay? If you have a sinus, it must have a P wave, okay? So, just to sum it up here, P wave, what is it? It's SA node firing, the atria is depolarizing, contracting, stuff like that. What's the QRS complex? Atria is relaxing, and then the AV node, the ventral AV node fires, and the ventricle, that contracts too. And then what do you think the T wave is? It's the ventricle relaxing. Pretty easy. So what's the most serious form of cardiac arrest? And it's usually irreversible. Asystole, we know that. So, sinus tachycardia, what's the rate? Greater than 100, we know that, okay? Not hard. So there are some primary prevention and detection ways for this. So with some primary prevention, you can do heart healthy lifestyles, exercise, daily low dose aspirin, and stop smoking. Then we know there's secondary as well. Those are very important. So there's a perfusion triangle. So the three things that make up perfusion: you have to have a heart, you have to have blood, and you have to have blood vessels. The heart is the pump function, okay? If there's any damage to the heart, the ability of the heart to pump, it affects the ability of the heart to function. Therefore, it cannot move enough blood through the body to support perfusion. The blood vessels are the container. If all blood vessels dilate at once, the normal amount of blood volume is not enough to fill the system to provide adequate perfusion to the body. And then the blood is the content function. If enough blood or plasma is lost, the volume of fluid in the container is not enough to support the perfusion needs of the body. As you can see, the heart, blood vessels, and blood, anything messes up, basically, we're not going to be able to get enough blood to the body. And these are some medical interventions. We'll go over these later. Some more assessments. Skip that. It's important, maybe. Okay, recap. So how do you think blood flows through the heart? So you're going to have, it goes to the superior inferior vena cava, to the right atrium, to the tricuspid valve, to the right ventricle, to the pulmonary valve, to the pulmonary artery, to the lungs, to the left atrium, to the mitral valve, to the left ventricle, to the aorta, and then to the rest of the body. So, when the heart fails, you're going to have BP changes. Low pressure can indicate decreased cardiac output is observed with people with heart failure. Angina, you're going to have reduced blood flow to the heart muscle. The heart needs oxygen to survive. Without oxygen, you have ischemia, which leads to an infarction, basically, if you have ischemia prolonged. Then blood volume is important. And you just check labs and stuff. So that's that one. Not too bad. We'll go on to the next one.